Today I want to give you information on vitamin D and its relationship to our immune system, and I will also talk about vitamin D in reducing the risk of ovarian cancer. A lot of interesting research points to an important role of vitamin D, more specifically calcitriol, in the body's immune system. Most of this research has been done in cultured cells, cells isolated from the body and grown in very special solutions of nutrients, and in animals with either severe vitamin D deficiency or whose genes have been altered to knock out proteins that control vitamin D metabolism or active vitamin D action. Now, these types of studies are essential proof of principle that vitamin D is important for the immune system. Now, on top of this, there are a lot of studies that draw associations between either estimated UV light exposure or serum 25-hydroxyvitamin D and certain types of infections or conditions. Now, because of these studies, scientists are pretty sure that vitamin D is important for strengthening the immune system. What isn't known yet is how much vitamin D you need so there's enough calcitriol to maximize the way your immune system works. So research is ongoing, and the rule of thumb is at the moment is taking 5,000 international units per day, and higher amounts are usually prescribed by your doctor. Now, certain B cells and T cells coming from your bone marrow and the thymus gland have vitamin D receptors and can respond to the calcitriol, whereas some phagocytes can convert the 25-hydroxyvitamin D into calcitriol. Now, this suggests that the phagocytes may communicate with the T and B cells through the calcitriol. But the research studies on the cells of the immune system show that when calcitriol is present, it blocks the features of the adaptive immune system that would lead to autoimmunity. See, animal studies show that when calcitriol is absent, the cells of the immune system are more likely to attack the healthy cells of the body, possibly leading to an autoimmune condition. Now, vitamin D deficiency isn't the only or even the primary cause of autoimmunity. It's just not good for the immune system when vitamin D is low. Now, unfortunately, it's not clear yet how much vitamin D you need in your body to lessen the impact of autoimmunity on your health. Now, vitamin D as calcitriol influences the immune system in two ways. Calcitriol avoids triggering and arming the T cells during autoimmunity. The T cells play a major role in autoimmunity, and calcitriol helps diminish the role and blocks the increased production of the specific helper T cells needed for autoimmunity. So blocking the production of these cells decreases the ability of T cells to recognize the native protein as foreign, so fewer killer T cells are produced. In other words, the presence of adequate levels of vitamin D and calcitriol keeps the T cells from attacking the body's own tissues. Now, calcitriol blocks chemicals that kill native tissue as it decreases the number of T cells, and calcitriol also diminishes the role of B cells in producing chemicals to destroy native tissue. The antibody response to the body's own tissue is decreased and the reaction is blocked. So, for example, diminished destruction of the beta cells of the pancreas, the cause of type 1 diabetes, are proposed to result when adequate levels of vitamin D and calcitriol are present. So if you are dealing with an autoimmune condition, get your vitamin D levels checked by your doctor. And there are studies showing that multiple sclerosis is caused by low levels of vitamin D in the body. Now, let's look at the role of vitamin D in ovarian cancer. This cancer may arise in the ovaries, the oval-shaped organs found in pairs in the female reproductive system. Now, studies suggest that vitamin D plays a role in preventing and treating ovarian carcinoma. In 2009, about 21,550 cases were diagnosed and 14,600 women died of ovarian cancer just here in the United States. The evidence that a lack of vitamin D plays a role in the occurrence of ovarian cancer is interesting. However, this relationship isn't secure yet, but evidence that vitamin D plays a role in preventing and treating ovarian carcinoma includes the following. Calcitriol slows the growth and increases apoptosis, or what we would call suicide cell death of the cultured ovarian cancer cells. Drugs designed to act like calcitriol inhibit the growth of ovarian cancer in the animal models. Results from several smaller studies suggest that higher 25-hydroxyvitamin D levels might be protective against ovarian cancer. However, a recent study that combines several smaller studies show this may be limited to overweight women. Now, if you'd like to see this segment again, please head over to my YouTube channel at youtube.com/drwardbond and feel free to email your health question directly to me through my website, drwardbond.com/contact. Fill out the info and send me your question. Remember, it's free, as I'm here to help you. So stay tuned. I'll be right back.